Okay, so you want to cut through the noise, get right to the heart of things. That's what we're aiming for.
Yeah, definitely.
Today, we're looking at something a lot of people are curious about. Potential signs, maybe indicators of ADHD.
Right. And we're working from just one specific source today. Yeah. An excerpt that talks about some possible symptoms.
Exactly that. A really focused piece. So our mission, if you like, is just to pull out the core ideas from this one text. What are the main takeaways?
Sounds good. Let's get into it.
So this source, it jumps right in, highlighting some key areas. Where does it start?
Okay, so the very first thing the source mentions is, and I'm quoting here, problems with attention and focus.
Right. Problems with attention and focus. What does that really mean according to the source? Is it just, daydreaming sometimes?
Well, the implication seems to be it's more than that. It points towards a persistent difficulty,
Yeah.
trouble staying concentrated, or like zoning in when you need to.
Persistent. Okay, so not just your everyday, oops, lost my train of thought moment. It sounds like a more consistent challenge.
That seems to be the idea presented, yes.
Yeah.
A consistent struggle.
And then it moves on, right? There's another key area mentioned.
It does. The second one listed is impulsivity.
Impulsivity, okay. And that's not just being spontaneous.
No, not quite. The way the source frames it, it sounds more like a tendency to act on an urge pretty much immediately,
Oh.
like without pausing to think about what might happen next.
Ah, okay. So maybe that looks like, I don't know, interrupting people a lot or just blurting things out.
Could be. Or making sort of snap decisions without really weighing the potential consequences, that kind of
That
thing.
immediate urge, yeah, got it.
That urge to just do something or say something right now. And then there's a third potential indicator the source brings up, which is
Constant motion.
constant motion. Okay, I can picture that. Like someone who maybe can't sit still easily, always fidgeting, maybe tapping their foot, needing to get up and move around. Yeah, that's a good way to think about it. Even in situations where, you're kind of expected to be still.
Yeah.
It's like an inner restlessness that just has to come out physically.
Interesting. So we have attention and focus issues, impulsivity, and this constant motion.
Exactly. But here's something really, really important that the source stresses, and we need to stress it too.
What's that?
These are described as possible symptoms, possible indicators.
Right. Crucial distinction.
Yeah.
This isn't a diagnostic tool we're reading from.
Absolutely not. The excerpt is just flagging things that might suggest ADHD could be a possibility, perhaps warranting a proper evaluation by a professional. It's not a checklist.
Okay, that's super important for listeners to grasp. These are potential flags, nothing more from this specific text. And connecting this back to, why we do these deep dives, understanding these specific points gives you a basic vocabulary. A starting point if you hear people talking about ADHD or if you're just trying to understand it better yourself.
Yeah, exactly. Having this information just from this one source means you can engage with the topic, maybe understand certain experiences a bit better, whether they're your own or someone else's. It's about building that foundational knowledge.
So let's quickly recap then, based purely on this excerpt. The potential indicators highlighted are ongoing issues with attention and focus.
Yep. Then that tendency towards impulsivity.
Acting without thinking it through, right. And finally, that sense of sort of constant motion or restlessness.
Those are the three key points from this source.
Okay, so as you're listening, maybe think. Do these descriptions, as laid out here, spark anything for you? Do they sound familiar or raise more questions?
That's a great prompt. Does hearing these specific descriptions make you wonder about how they actually play out, or what someone might do if they were concerned about these things?
Right, because this deep dive, it's just scratching the surface based on this one piece of text. Understanding these potential signs is, like we said, a first step. Good one.
And the starting point.
So we really encourage you to keep that curiosity going, If this topic connects with you, keep exploring. But for now, thanks for diving in with us.